Now let's go over some testimonials. The first testimonial is of a 78-year-old lady. This was 2018. I treated in America for all the multiple conditions listed. But the reason why I'm showing this slide is the daughter, after 12 days, sent me a text that the mom also have severe dry eyes, to where she would wake up many times for drops. Since the procedure, she said she has noticed no problems with eyes. They did not tell me about this during the consultation, and they didn't think it was going to work, so they didn't think it was important. But less than 2 weeks later, you can see what it says. Again, back to what I said earlier, stem cell does not know your diagnosis. Whether you got it right or wrong, it takes care of it. I know we've been talking about adult stem cells. Some people may be concerned, does it even work in children? Like I said earlier, adult is not about age. This is, let me see, a short video that I'm going to play so that we can see how the 4-year-old boy improved within 3 months.
Juice?
Yes.
Water?
Juice.
Juice?
Water.
Water?
Juice.
Orange juice? Water? Juice? Orange juice?
Juice.
Juice? Water? 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 Juice? Water?
Now, 20 weeks later, roughly, last year, when I tried to follow up with the parent, and they sent me a message back stating that now he was even able to identify and ask the mom that he wanted morphine. And also, not only that, even called the mom mommy. So that was, a positive thing for the family. And yesterday, I sent them a text, to find out if there's an additional improvement. So they said it's talking better. And then in the text, I got a message back that it's even able to use toilet on its own. It's able to identify most of the colors now. It's set too small at the dining table. So that's some improvement. It's not only stroke in adults that this can help. Cerebral palsy, which could be either from jaundice or deficient of oxygen while giving birth to a baby, or whatever the cause may be, have different ways it affects our children. So this is one of what we've been doing, treating patients with cerebral palsy, but this is a recent one that was treated, and on June 9th. So that's like 2 weeks later when I asked her the child was doing. But the point is, the mother was trying to tell me that this child can now climb 2 level steps and a high steps. So when I asked if she was able to do this before, just to get some clarity, they said before she couldn't. She would only make an attempt. So I encouraged them to continue physiotherapy. And so they came for second session on July 12th. So when I follow up how the child was doing, they said the sleeping is better, the movement gait is slightly better, in the sense that when we make her walk, she does not wobble as much. The number 3 that may not be shown clearly to you is she can sit on the floor and on a paired chair without support or leaning on something. And the 4th one, for those that are not seeing this, is that She can pronounce some 2-syllable words. She was treated on June 9, and this is July 14. That's almost about 5 weeks, if I'm correct. So that's a 6-year-old, and you can see what is happening within 5 weeks. That's what I mean, that when we orthodox doctor says there's limits to what we can do, regenerative medicine doctors are saying that there may be hope. And this same child, further discussion I was made to understand that involuntary movement of the legs that the girl was having decreased a little after the first treatment. But yesterday, we noticed the movement reduced a lot more after the second treatment again. That's the same day. You see a video in an adult of improvement in less than 10 minutes. So what you are reading is possible, but you will see it, visualize it yourself. Oh, okay. I will go over this quickly. This is a case that we submitted to Journal of International Case Reports, and they accepted it. This is one of our patients with arthritis, and even that was April 3rd, but April 20th this year, it was published in the Guardian newspaper. The lady had arthritis of the 2 hips and went to America, had surgery on the left, as you can see on the screen, the metal implant, and then later on did not like her experience, so bluntly refused to have surgery on the right. And then this is how she was, she was getting steroid. Please, if you're on this line and you're being offered steroid, it's going to damage your cartilage, either your knee or your hip. And some people even cause a vascular necrosis in the hip. It reduces the inflammation, it doesn't repair. If anything, it degenerates. So of course, at our centers, we don't give steroid anymore, because we have something better. But I just want to point out. So you can see on the right side of the screen, the left hip got worse, so she had surgery. And then on November 17, 2020, we repeat the X-ray. You can see what it looks like on the left side. And of course, the standard protocol is an hip replacement, like she did on the left side, which she doesn't want. So in this case, we went in with everything we could give her, not 100% everything, but most of the things that we could do for her. And the pain reduced from 9/10 to 3/10 within 2 days. By 3 weeks, it further dropped down to 2/10. In less than 2 months, it dropped down to 1, and she was walking around pain-free in less than 3 months. So this video is showing you in the left side, 3 days before the treatment. In the middle is 6 months, and then on the right side is 10 months. This one is just comparing 3 months to 6 months. Comparing 3 days before to 6 months. And this was comparing 3 days before to 10 months. And this is comparing 3 days before to 1 year, 2 months. Which is 14 months. So this is just for you to see that even though she's pain-free in less than 3 months, the regeneration process, it doesn't happen in 1 day or 2 days, is continual. And this is even up to this, the last one we had is 2 years. And this is just showing you all the stages she went through. So this is before and after 2 years, 3 days before and after. This is someone that the only thing orthodox medicine does is offer hip replacement. All right, so let me move fast. It's the same thing. This is a recent patient with 2 years of stroke. On the left side, you can see how extensive the damage is. The first MRI of the brain, that's on the horizontal level. You can see how wide that is on the left side of the brain. The lower MRI is, that is taking the picture from top down, and you can see the depth of the damage. The patient also had kidney issue, diabetic as well. It was in 3A, stage 3A, Within 2 months, we improved the kidney function to stage 2. Somebody wasn't talking. Actually, the patient was referred to us by speech therapist. Within 17 days, he started saying words that he has not. He started saying words that he has not said in 18 months. Then the second treatment was 6 weeks later, and you see what happened now in video right there in the procedure room. So it's a 2-minute video. So it's move your fingers for me. Notice how clean. Can you move your fingers? So that's what you can do right now. Today is Thursday, 27th of April, 2023. It's not up to 10 minutes. It was contracted before. Just try and do some things with your fingers. Okay? Can you bend your hand from elbow joint? Can you move it down?
Like this.
What did you say?
He said, okay.
He's speaking. Okay. Can you make a statement? What's the name of this city? Where are we?
Ikudayisi.
Okay. What of the state?
Ikudayisi.
Okay. Anyway, how are you doing?
Fine.
Do you have any complaint?
No.
As you can see, the hands are almost fully open. Today is May 24, 2023. I'm going to ask you, sir, to try and raise up your right hand. Do some movement. Okay. About 3 weeks ago, walking, I've not had time to add that section. He was able to walk by himself using a cane, a 4-leg cane. And this is somebody that came to us in wheelchair and was first treated on March 15, 2023. Remember, 2-year-old stroke. You saw the MRI. So as regenerative medicine accelerate the healing ability. Move your fingers from the body. But this one is a recent stroke that is 5 days old, only 1 treatment. Remember at the beginning, I said the take-home message is the earlier, the better, and the less expensive this becomes. So this is a stroke that was treated within 5 days. The last video you saw was a stroke of 2 years old, but all hope is not lost. So this one couldn't speak because it affected the left side of the brain also. The next day started speaking, the next day started moving. And less than, I think 52 or 54 days, walking around without a cane. So I think it's a minute video. Because of time, I'm going to fast forward. By 3 weeks, with physiotherapy, he's able to walk without a cane. 20 days, also without a cane. 3 days, you can see the speed that he is going. So that's but those ones are non-bleeding stroke. This one is a bleeding stroke. So for those that are wondering, it can help both bleeding and non-bleeding. And this one could not recognize the husband, could not walk, but they call us 12 days after the incident. Our team went to the hospital. This was in Ekiti, and we did what we could, and the family was happy about the improvement. This is another stroke of 46 days old. This one is published about similar stroke that there's poor prognosis. This is not our patient. I'm just trying to let you know that the prognosis is poor for people with this streptocapsular infarct. That's what our patient had. Patient came to us 46 days later with was initially diagnosed with subacute. Actually, at the top is the ischemic, that is non-bleeding stroke of streptocapsular infarct. By the time I requested for MRI, it has gotten worse with bleeding, subacute hemorrhagic transformation. But we still went ahead and treat, and patient improved. The identity is not fully protected, so I won't be showing that. But what happened is patient came in right there on the treatment table in less than 10 minutes, just like you saw on the chronic one. The face that was asymmetric immediately became symmetric, was moving the hand better. The next day was able to walk better. And actually the patient is driving around now. So this another patient also with improvement from stroke, and sugar became controlled. We have a recent comatose patient, which is our first one, who neurosurgeon and neurology have given up hope, but the family member of the doctor is so happy, and this is less than 2 weeks now. So at the next seminar or webinar, I'll be able to give you better results. This is our diabetic patient that was only 4 to 6 months old of the diagnosis. We were able to get her off diabetic medication. She gave video testimony. I won't play that because of time. Again, the earlier, the better. If it's 5 years, 10 years, yes, we can help you control your sugar, but you will need multiple sessions to even get off the diabetic medications. And don't even guarantee that. This is a patient with diabetes, a kidney problem, on dialysis for 15 years. After using fat, was able to read newspaper the next day, stool improved. The blood pressure was fantastic for the first time in 15 years on dialysis. Blood pressure started getting low, sugar started getting low. He had to skip the medications. He stopped blood transfusions. He stopped getting epogen injection that boosts the production of red blood cells at 5 months. So these are benefits. Yes, we didn't get him off dialysis, but as those in the scientific or medical doctors, whoever is on the line, you have read that if somebody's going to get kidney transplant and they get stem cell therapy, the risk of rejection of that transplant is very low. So again, it modulates immune system, like we said earlier. It affected his, it improved his sexual function, even though we did not directly treat him for AD. This is another patient we treated for diabetics. In this case, he had 3 sessions. His sexual functions went from 15/25 to 22/25. 22 to 25/25 is normal. So we brought him back to lower normal range, but he still wanted to treat directly his private part, and that within 2 days, he was able to feel stronger, more potency, lasting longer. Not only men. This is another woman who came to Tampa, Florida from Canada, and because of the son that was being treated for autism, they found out that we do OSHOT, so she asked, and we treated her. When asked about the son, our own response about herself was, my lubrication is good, no more stress, no more pain during sex, and orgasm is even more intense. So, and we've treated female genital mutilation. There's O. This is common in some part of our country. This is somebody for many years who has no experience of what it means to have orgasm. So for 36 years, she's not been enjoying a sexual relationship. So she was very happy within 3 months, what she could do with the husband. This a wound that will not heal for almost a year. Within 6 days, as you can see on the screen, it dried up. We wrote an article about it. It's a Nigerian treated in Lagos here. And 2018 was when we wrote the article. It was published. And October 2018 is when they published it. That's my name in yellow there. If it's knee problem, it can be taken care of. Those are just meniscus tear. In medical school, they taught us that the meniscus don't regenerate. Once they are gone, they are gone. Cartilage don't regenerate. But with regenerative medicine, we are finding out that those things are not true. If you have bone on bone, like you can see on the right side of the screen, you will need more than one treatment session. So when you have arthritis, with the small, cheapest form of PRP, even I mentioned that centers use different PRP kits and whatever. Even wherever you go with the cheapest, go and meet your doctor. Let them inject you PRP. Don't wait until your arthritis go from mild to moderate or severe. Because the earlier you start regenerating, the better. You don't want your condition to be bone on bone like you see in the left knee on the right side of your screen. In the inner part, you can see that. It becomes more challenging. It's treatable, yes, just like the hip, but it becomes more expensive. So please, find somebody close to you and get treated. The pain in the knees, this is the same patient we treated. There was improvement. There's so many slides, I have to go through them. A vascular necrosis. Somebody asked that question. Yes, we have a couple of patients in Nigeria we are treating, and they're improving. 70-year-old, I think they came from Kano or Kaduna. I asked the son, how are you doing? He's like, look, I want to talk more about my father because of his condition. Because the dad is now, is the amazing one. You won't believe what he's doing. His enlarged prostate and PSA test came down for the first time in a long while. Dementia has improved tremendously. Oh, sorry. I said Kano Kaduna. I'm wrong. They came from Sokoto to Lagos for treatment. So anyway, I see some people are raising their hands for questions. We get to that. Let me just move fast. And which one is this? Low back pain for 5 years, went to zero within a short period of time. I think that's within 2 weeks within 12 days. So low back pain. This one is interesting. I'm going to fast forward it. 75-year-old, low back pain, disc problem, yes, narrowing of the space, lumbar spinal stenosis, we call it. But 3 months later, from nowhere, she did a video on her own and she sent it to me. I was not in America then. So let me see. I'm going to fast forward it to the important part. She felt better immediately. The next day, she said her pain is pretty much gone and she slept better. When I followed up, how are you doing? Let's see. I'm trying to fast forward it, please. Yes, this is what I want to show you. Now, see the angle at which she stood up. And there she goes, walking without a cane, upright. See, somebody was bending. So, again, there is hope with regenerative medicine. We doctor says there's no hope. All right, this one was paralyzed, and I think pretty much, these are before and after for exosomes. Within 7 days later, no scar. 2 months later, no scarring. There's nothing in medicine, apart from regenerative medicine, that you have a second-degree burn like this, and your skin will be smooth 7 days later or 2 months, 2 months later. Well, this is a perforation that takes about 6 months to heal. The perforation closed in 3 weeks, and you can see the picture 4 weeks later, and then 10 months, crystal clear. Exosome is also good for diabetics. I think this is within 6 weeks. It went down from 10.1. Let me see if I can move this. Yeah, to 6.5. Okay, sorry. Autism, we've spoken about autism. Okay, this is one that I said the mother came and got shot. This one's from UK. Everybody happy, because I don't want to spend too much time on autism only. Now, using your own blood, this one of our patients, 5 months later, you can see the skin is glowing. The collagen has improved. So there are many centers in Nigeria doing, even if they use the chippy, it will still work, you know. So if you want to drive keke napep with cosmetic, you can get away with it, or you want to drive Ferrari, it's your choice. But for other conditions, yeah, it doesn't work that way. This hair loss, you know. Testicular atrophy, shrunk balls. There's nothing orthodox medicine can do to make your ball grow back to normal. This is, it grew back to normal, you know, and verified by third party as well when they did their own ultrasound. Premature ejaculation, 10 months later, send a text, say he's good, he's happy with what his wife was doing at age 52, that he is. We talked about arthritis already, knee pain, low back pain. You can see on the right side, they call it anterolisthesis, you know, arthritis of the back, you know, the bone sliding. You can do surgery, or if you don't want to do surgery, you can reduce the pain with adult stem cell therapy. You solidify it. Some patients that have mild scoliosis, even they do their X-ray in UK, after treatment, they come back or they go back to UK and their doctors tell them, what happened? You don't have scoliosis anymore. All these things are not gimmick, it's all possible. I said mild scoliosis. I'm not talking about severe, that the person is already bending. No, that we need surgery. Please. Again, the earlier, the better. All right, so shockwave, we spoke about that already. You know, this one, I mean, the interesting part about this one is 3 years looking for diagnosis. We couldn't find it. Everything was, but just one session of shockwave, gone. And months later, you know, she even forgot that he has a pain there. It's because that was musculoskeletal. If it's a major arthritis, you know, one shockwave will not take care of it. So please, don't let's get it wrong. All right. So pretty much, I hope we know what can be done with our own blood or our own fat or bone marrow or umbilical stem cells and exosomes from a donor. And in conclusion, please let us remember that the earlier the better. No promise of cure, but yes, for every treatment session, you always get improvement. Like the stroke patient that we all saw, 17 days was able to say words that he has not said in 18 months. And then 6 weeks after, when he got the second session, right there on the table, his stiff arm, everything opened up, he started moving, he started saying words better. And now he's walking around with cane without support. You saw the MRI. It's pretty much, you know the answer to that. So many conditions can be treated, and adult stem cell therapy is safe. Adult. I did not say stem cell therapy is safe. Adult stem cell therapy is safe. Of course, PRP is everywhere, you know. So thank you very much. Over to you, Dr. Kolawole.